We'll move on to item number 4.
Resolution 20-2297, review of Section 6 mask mandate with Jason Tiller, Health Department Director.
Good morning, Jason.
Good morning, gentlemen, everybody.
Good.
So it's been 2 weeks. There we go. So again, like the last time, just kind of starting at the national level, we've reached over 5 million cases in the U.S. and over 163,000 deaths, and this is as of noon yesterday. Since we're kind of doing this every 2 weeks now in this similar format, I'm going to start adding, like I did today, what those changes are so you can have just an idea of what that is. So that's about almost 800,000 new cases and 16,000 new deaths in the last 2 weeks. And that's nationally. In the state of Kansas is now up over to 31,000 cases since the beginning. That's 6,000 more in the last 2 weeks. And I think probably the biggest jump in the last 2 weeks of deaths, where there's been 52 additional deaths in the state in the last 2 weeks. At the county level, so we've got some red and some green. So we've got some good news and we've got some, well, just continuing trends, I guess. So 389 cases total in the county. That's 62 more since the last update. However, we have had, we're up to 285 recovered. So that's why you see the green there. Although it is a plus in the number of recovered cases, but that is a good metric. We want to continue to see that number increase. The active number, of course, is down, but that number fluctuates. So right now we're at 99, and then we had one additional death from the last update. Hospital still averaging about the same. Counties, I'm sorry, the state's positive rate is at, I should have brought my glasses this morning, 9.8%. Which is up 0.5% since the last time. And our case rate right now for the county is 6.8 per 1,000 residents, whereas the state of Kansas is now at 10.89. So we're still doing better than the state overall. Just looking at the trend, since from our last one, we did kind of hit the end of July and then going into August. So this is July. And you can kind of see starting at about July 20th, well, the weekend before that, I think it was, we had like 14 and then 16 cases, you know, in those days. And then we kind of have taken now this, what I kind of call a smoldering level of cases, because they're just a handful each day, but it's continuing each day, except for the one blip that we had there on August 4th, which was a Tuesday. And I think that one was just related to delayed reporting from the lab from the weekend, because those cases weren't related to a cluster or to anything. They were just from various circumstances. A couple of other things I wanted to mention. So since May, we've been having bi-weekly meetings with all the colleges and universities, the K through 12 schools, and public health. We have been sharing information with each other, resources, planning for reopening, looking at the situation. As one organization might be trying to figure out how to address or find a solution to a problem around reopening, and maybe one of the other organizations has something that they've tried. So it's been a great coordination and sharing of information. And from this too, we have been working on a decision matrix. And it's been a challenge because there are no good models out there, because by the time the pandemic got into full swing, all of the schools were closed in the spring. So there's not any real good modeling data that says, okay, this is what's going to happen. There's not any good set of numbers at this point anywhere. And this is even after consulting with some staff at Wichita State and K-State, that we can say that at this percentage or at this number, X needs to happen. So as far as this matrix goes, most communities are working on something similar, I think. And it's going to be a living document that we continuously work on. But it'll be available to the public so that the public can see how decisions, when the community conditions change, what the assessment looks like and how those decisions are driven when schools decide to either, when one school district decides to stay in the mode where everybody's in class and another one decides to move to hybrid versus remote, so that there will be some transparency to that decision-making process. And then a couple things I wanted to say on data. I know that there are lots of rumors that fly around about data and numbers and who's counted and who's not counted and all that kind of stuff. But I can only speak to our data here in this county. And I know that for every number that's on those charts about the number of cases, that represents one person. It doesn't matter how many times they've been tested. Sometimes we've had where people have been tested 2 or 3 times, they come up positive 2 or 3 times because the virus particles can hang out for a little while, even after you're technically recovered. But they're still only counted once. It doesn't matter how many times they're tested. And then the other thing is that everybody, for every positive test result we have, every single person that we have contacted and interviewed for those results has actually been tested. There was a rumor floating around out there about people waiting for hours. I think if you look at Facebook, you'll find it in this state, that state, and that they left, they never got tested, they got positive results. I can say 100% accuracy and assurance that that has never happened here. We have never had a single person say, well, that's odd, I never got tested, so I don't know how I got positive test results. We work very hard to ensure the validity of our data, that the numbers are correct. We still continuously have a little bit of an issue with KDHE's website underreporting our numbers, and we've been trying to get them to fix that, and that still is, but that's on their end. We send them our data and try to get them to fix it. And then I wanted to talk a quick minute about isolation and quarantine, just because sometimes it can get a little confusing. So, isolation is for those that have tested positive or are ill with symptoms. We isolate the ill. Quarantine is for those who have been exposed to those who have tested positive. So, isolation is generally for 10 days and 72 hours fever-free, whichever one is longer. So at a minimum, they're going to be in isolation for 10 days from the start of their symptoms. Quarantine is for 14 days from the date of the last exposure. So it is possible, as you can see on the screen here, that if someone is a household contact, meaning they live in your house, so say I test positive today, and my family members that are in my house, because we have exposure, have to be quarantined, but my isolation period doesn't end because, say, my symptoms started on Friday and I have 8 more days of my isolation period. Their quarantine will not start, that 14-day clock does not start until the end of that isolation period, because they are continuously being exposed during that isolation period. So that's one of those things that is constantly being explained over and over again. There are some examples on this chart about that. Non-household contacts are easier because generally their last exposure might have been 4 or 5 days ago by the time that the person who tested positive received their results. That's pretty easy to set a definitive start and end date. But it's the household contacts that are sometimes harder to set those dates for, because it just depends on when that exposure ends. On the other side, if somebody is in their 14-day quarantine and then on day 14 develops symptoms and gets tested and is positive, then that would start the 10-day isolation period. So there is possibilities, the way these scenarios work out, that somebody could be in isolation and or quarantine, and that lasts up to over 3 weeks. So I know we've had that out there on Facebook a few times, but during this forum, I just wanted to kind of bring that up and talk a little bit about that. Yes, sir.
Yes, Jason. Is it a person at that time would not be considered as recovered until after that 30 days or 28 days?
So the person that is positive, in order to be considered recovered, they have to have a significant reduction in symptoms, have finished their isolation, that 10 days isolation, and be fever-free for 72 hours without using medications. Originally, back in the beginning, you had to have 2 tests 24 hours apart, but that wasn't feasible when there wasn't enough testing. And then sometimes tests can take 4 or 5 days to get back. So somebody would end up having to sit another 10 days just waiting on tests. So the criteria is symptoms are significantly better, no fever for 72 hours without using medication, have finished that 10-day isolation, and then they're considered recovered. Now, being considered recovered does not mean, though, that they still don't have ongoing issues related to COVID. We have seen, and it's in the literature, and we have in many of the ones that we have seen, that still have ongoing health problems related to their COVID infection. So they're not considered active anymore. They have recovered in the sense that infectious period is over. However, their battle, I guess you could say, with COVID is not over yet.
Thank you.
Just before you leave that,
Yes.
so a person who is infected goes into isolation, does their 10 days, and the rest of the family will start their quarantine. Does that original person, are they free to leave that quarantine and be back out in the general public?
So the original person that was infected, once they finish their isolation period, yes, the rest of the family members are in their quarantine, but the original person who was the index case for the household, once they finish their isolation period and have been released from isolation, yes, they can leave the home. At that point, they're not shown to transmit it anymore.
Well, Mr. Chair, as I said 2 weeks ago, I appreciate my fellow commissioners putting up with this part of my motion that we do this every 2 weeks. And so it is not my intentions, obviously, to make a motion that we get rid of it right now. But I do think I learned something, and I think the public learns something every time that Jason presents like this, and I still think it's helpful for us to do that, especially the myths that are out there.
Yes, sir.
You're coming up with some very valuable information for us to make the decisions, and helps the public also in their understanding of what's going on, because I too have heard some of the things that you've absolutely said, and get into some pretty good discussions with a couple of my friends over it, and so it's valuable information. I'll win the next argument with those guys, I can tell you that. I might have won anyway.
The one that I can at least speak to is, the rumor that when people turn around in the long lines, that they get, tested and it says positive. And I can only speak to my experience. And yes, I did have to wait an hour in line. And I did see people turn around. But you don't register your name until you're the car right in front of the testing thing.
Right.
So they never knew Monty Shadwick was in line until after an hour when I got to the first tent, and then you registered, and then you went and you got tested. So anybody that turned around, now again, that's only my experience, but I can't imagine it being different in any other situation.
So like when Walmart was doing the drive-through testing, there was an appointment list, like it is when you go to the doctor and they have your appointment list of who's scheduled to show up that day. But that doesn't really count until the end of the day when whoever actually showed up. That's the names that get counted that day for who actually, and it was the same way. Their appointment list wasn't useful for us in a sense of who actually got tested for trying to make sure that we were reconciling to have results. We had to know at the end of the day who actually got tested.
Right.
And so, yeah.
Do you believe that we are getting the right people tested? Do you think people are not getting tested because they're worried about the delays and it just doesn't matter? I mean, that's one of the things you hear about, and I'd like to know your thoughts on that.
I think sometimes some of the I think some of the reason that people don't get tested is that because they know by getting tested that they're going to have to miss work.
Wow.
And so I think that's one aspect of it. One of the things that we're kind of running into lately, and we're trying to educate people, is the stipulations under the Family First Coronavirus Relief Act and how that 80 hours works, and I think Maryland's already left, but and then how businesses are supposed to, work with that act in relation to like family medical leave, what businesses actually qualify, because we've had, at times a couple of people call and say, well, if I'm on isolation, they're going to fire me. Well, technically, I'm not an HR person, but our understanding is that they are not supposed to be able to do that under that Family First. But again, we have kind of started steering them toward Kansas Legal Services. Definitely tell them to talk to their HR to make sure of what their options are under that act. And then, but I think that's one of the bigger issues.
Jason, let me ask hopefully it has a short answer to it, but if someone is feeling, like they need to be tested, what's the process?
Contact their primary care
Contact
provider.
their primary physician, and they will then guide them in the direction that they need to go, where to get tested, so on.
Right. So what a lot of them are doing is just kind of a primary screening over the phone. If they determine that, yes, this sounds like COVID, or you've had exposure to COVID, then they'll direct you to one place to drive through, like Stat Care or someplace like that, and get tested. Or if you're going to come to, like, say, Saline Family, come to this specific door. This is where testing's happening. If it's something else or it's unsure, then they'll do additional screening, have them come in, make an appointment, that kind of stuff, because every illness is not COVID. Every accident is not COVID. No matter what they see, not everything is counted as COVID. So they want to make sure that they are doing the right screening to get them the right treatment. So.
Okay, that makes a lot of sense, and encourage people to contact their primary physician. And your sinus headache does not mean you have COVID necessarily.
Not necessarily, no.
Yeah. Okay. Any other questions from commissioners?
Yeah, a couple. When you're speaking about testing, some of the problems have been as the length of time to get the results. And are the quick turnaround tests now available in Saline County? Are you seeing those available? And to follow up, what is the validity of the test itself? You hear about a lot of false tests.
Right. So the gold standard of testing is the PCR. And that's the one going up the nose. Whether it is the very all the way back, feel like it's tickling your brain swab, or they do have another one that kind of what they call anterior nares that kind of goes not quite as far back, but those are still PCR, and those are the gold standard. The point of care, like quick tests that you're referring to, they are from my understanding, a rapid PCR. I believe the hospital has a small handful that they basically reserve for like really sick and they need to know now kind of thing. The issue with trying to get those is a supply chain issue. They're just not being produced fast enough to be able to get into the hands of all the hospitals and everywhere else that need them. I know that some health departments have talked about trying to use some different funding to get those machines, and quite frankly, they're not going to get it for 6 months if they ever do get it. So that's where the drawback to that is. As far as the validity, if it's PCR, whether it's the point of care or if it's the up the nose and still takes, has to go to a private lab or to a complex lab, I should say, and be processed, I think the validity is about the same, which I don't know the percentage, but it's upwards of 90% or greater. If it's positive, it's positive.
Thank you.
All right. That's all I've got, so
Well, I've got.
I'm going to bring it back to the commission for And I assume that your suggestion is that we continue to wear
Right.
face masks.
Right. I will tell you, with colleges and school getting ready to start, this is my most probably nervous point right now. Because there is no real data. We can look at some other countries. We're watching now what's happening in other states, but we really don't know, and I still can't find anybody to fix my crystal ball, so if you know of anybody that can help with that. But, yeah, we just really don't know, so we're going to be watching that closely, consistent communication with everybody as far as the colleges and schools as we move into this time period.
I don't think we need a motion then. We're just going to continue to look at it again in a couple of weeks, and hopefully we can continue those really low numbers that I think it has made a difference.
I hope so.
That's my opinion. So, all right,
Thank you,
thank you for your
Jason.
update, and thank you for
Thank
all the
you.
information.